Okay, so Tamarah, I have to say you're one of my favorite people to talk to about C-sections. I pick your brain all the time about this topic, not only because I know that you too see so many of these clients, but you've had four yourself. And so I feel like I'm always coming to you to learn more from your perspective. So thanks for doing this.
Yeah, no problem. My pleasure.
Can we start? You posted the other day on Instagram a post that said, I believe in a woman's right to choose. And I thought that would be a really good place to start because you do such a good job of helping women feel that their choice to have a C-section or that style of birth is just as valid as having a vaginal birth. And I think it helps women feel like, yeah, that is true. So speak to that a little bit because I think it's a great perspective.
Well, I think as probably most women can, contest, like having had a C-section, whether it's planned or emergent, there's a lot of emotion around it. And there's also a lot of ideas of whether or not it is right or not right, or natural or not natural. And, that language can be quite damaging. And I experienced that, when I had my first 10 years ago. And so, there was some significant stigma around the word cesarean section. And something that, everybody's entitled to have an opinion about, absolutely. But I think, opinions need to be educated opinions and supportive opinions to be able to ensure that every person who's going through this, whether it's because of a choice or because of a environmental situation, they feel supported long-term by what their body has been through and by what choices may have had to have been made for them, essentially because of whatever has happened in that delivery room, right? And so, some of the language, like it's not a real birth, or, being less of a mother, or the grief, the anger, I really want to try to push society to get away from that kind of language because, even with the C-section Awareness Month stuff I've read, it's awesome because there is more people coming to the forefront with it, which is bringing more awareness, yes, but it still has a very negative undertone to it. And I really think that if we can develop a bit more of a positive, uplifting language or approach, or just community that can be more supportive in, C-section being, like you said, a style of birth, I think that's fantastic because it will reduce a lot of that sort of shame that women feel that I've spoken to have had cesareans, or that grief and anger. And, all of that should be addressed because you can still have those feelings even if your C-section was a choice. But then it should be feelings that are a result of your experience, not a result of what people are saying about your experience, right? Your experience is your own, and therefore you choose how you feel about it, and you're allowed to feel these emotions, and they will vary as you move through further deliveries, but they should be your emotions, not the stigmatization of what cesarean sections are. So yeah, I've just, in terms of birth being a choice, birth is a choice. You do make a birth plan. And, I think it's important that cesarean sections be included in that birth plan, for all demographics. So, my experience, unfortunately, in the number of cases in the last little while have been women who, because of their sort of demographic, or because of their concern about certain things in their body that they have in their history, they have been stripped of that choice and told to risk that for a vaginal birth, and despite them asking outright for a cesarean section. And so I take a strong stance on that, and I believe that woman should be heard, and individual should be heard, regardless of what they choose. So if it is a choice for them, then it needs to be a heard choice and a supported choice, right?
Totally. And
Mm-hmm.
I would say, like, I can think of so many clients that come in, and I'll ask, kind of, I'll ask usually, like, what brings you in here? How far along are you in your pregnancy? Is the plan for a vaginal birth or a cesarean birth? And, often when they say cesarean, you can see it with just kind of like this weight on their shoulders, like that they're
Totally.
disappointing me or something, that they haven't given me the answer that I'm looking for.
Mm-hmm.
And I'm sure you feel that all the time, but our C-section rates are on the rise, correct?
They are, and I think one of the things with the research that needs to be importantly stated moving forward is possibly why. Because there is a lot of women marrying bigger guys, or marriages of different people from different races, and that can be potentially part of it. Also, there's still, unfortunately, as I'm sure you've seen with everything that's going on in the world, like poor care for certain demographics.
Mm-hmm.
And I witnessed this just last week, unfortunately. And so, advocating for those demographics that, for choice, but also for, C-section or vaginal, right? And not being pushed into a C-section because they are of that demographic, or because they don't speak the language appropriately, or whatever, right? Because like I said, unfortunately, this week I witnessed that and was a part of, a situation with a patient with that I obviously advocated for. And so I think there's so many things that come into play when you're looking at the statistics. And so statistics need to be taken with a grain of salt and understood, well, what is actually facilitating this? Is it, where are the numbers coming from? And why are these women having cesarean sections? Are they failure to potentially progress? Or are they were they going to have like a high forceps delivery and that may have resulted in more damage? Mm-hmm. Or, could they just not get baby out? Or were they breech? Or were they, who knows?
Isn't there a lot of talk too about just like that women are having babies older, like with mm-hmm. further along in their life, and just that, like, the changes to our body, it makes it a little bit harder for us to quote unquote stretch that much, right?
And I mean, how under researched is that area,
totally,
right?
Yes.
So I mean, it could be.
Totally. I have another question. What do you tend to say? I also get a lot of clients that come in and say, I'm going to see my OB next week, and we are going to discuss whether I should have a vaginal birth or a C-section birth. And I know that a lot of times, and I think this is great, we've got a lot of young female obstetricians, gynecologists in Kelowna, and I feel like they do a great job generally of like, well, these are your options, you choose. But then that leaves mom kind of like, well, I don't know. I thought you would tell me what to do. What do you tend to, like, what do you point women to? Because I know a lot of them will be listening kind of on the fence of like, what is my birth going to look like? And what do you tend to give as an answer when they ask, like, what do you think? I know that's a loaded, I'm not looking for a black and white answer, because I don't give a black and white answer either, but what do you tend to suggest they think about? Or do you know what I mean? Make a list of pros and cons, or?
I think primarily the first thing that I would sort of look to or ask is, what is your ideal? What do you want to see happen, right? And what do you picture for yourself and your partner? And then, given that, then sort of working and speaking to like, okay, so do you understand what a forceps delivery is? Do you understand what a vacuum delivery is? And do you understand what a high forceps delivery is versus a low forceps delivery? And are you familiar with the grades of tearing and, what that means? And, are you familiar with what a cesarean section is? Do you know what like an emergent one may look like versus a dental cesarean versus, a VBAC, or sorry, not a VBAC, a planned cesarean, right? So I think we kind of work on discussing those first. And if a cesarean has been suggested for whatever reason, let's say baby's breech and maybe they won't turn, then I speak to, okay, well, what kind of options do I have going into the birth? As in, can I attempt a vaginal delivery? How quickly do I have to decide, or can I leave it to the last minute? And what kind of things can we put in place to potentially deal with that situation if we kind of leave it to the last minute, right? And then, of course, discussing sort of, emotionally, how do you feel if you had to have a cesarean section right now, right? How would you feel about that? And what does that mean to you? And, and kind of prepare the discussion like that with them, and then say, based on what you've spoken to me about today, why don't you take that to your OB and you can formulate what you think may be the best sort of starting point, I guess. Right?
Totally. And I think that, I think that's like, you touched on exactly what I was kind of like thinking that you would say, is that I think that there's a lot of misunderstanding or just no understanding about what that actually looks like the difference between the two, the quote unquote risks between the two, the pros between the two. And, everybody's going to come to a different decision. Right. And I think that if you can just educate and understand like what that actually looks like. And, Tamarah and I, not too long ago, created a webinar that explained to women, like, what does a C-section look like and what kinds of things can you do to prepare? And that's kind of what I wanted to touch on today, because I wanted to talk specifically about, I think a lot of women, I said that they feel this defeat, they feel disappointment, they feel like, I was so excited to plan for my vaginal birth, and now I'm just have to sit back and have a C-section. And no, not the case at all. And I thought we could touch on today some of the ways that women that are deciding to have a planned C-section, ways that you can still prepare your body, your mind, just like you would a vaginal birth. So let's start there. Let's talk about some different ways that you would suggest to your clients that they can prepare for this type of birth.
So one of the biggest things that I sit down and speak to them about initially is, let's gather how you feel about it. Like, do you know about it? What do you know about it already? And where are you coming from in that perspective? Because if it's a place of, well, my friend had one and it was really traumatic, which sometimes they can be, and I don't want that. Like, I'm not, and that's where I'm coming from. So I'm scared, or I'm fearful, or so I think if we can kind of break down what their feelings and thoughts on cesarean sections are initially is really important. And then, of course, like, do you know what it involves? And are you open to learning about what it involves? Because, it's a procedure, it's a surgical procedure, much like you've just been through yourself. And, it can impact every person differently. And so, allowing there to be space to understand and educate about what the actual procedure is can be really sort of important and supportive for the individual, and even change some of their initial sort of angst or ideas around what it was or what they thought it was, right? And so, allowing them to understand that it is a very significant surgical procedure. And so, taking care of your body and getting prenatal support, as well as then postpartum support, and having that in place and your village in place is of utmost importance, right? And learning and discussing that early on can often allow them to relax into that decision and go into the surgery feeling much more confident and, confident in their decisions, but also confident in what they can ask for, because there's a lot that you can ask for and potentially discuss prior with your provider, your OBGYN who will be doing the surgery, if this is, for example, planned, right? And, in terms of discussing it with it where it may be unplanned, in an emergent situation, just allowing the individual to sit with that and, going, okay, so this is what it is, and this is, when it could potentially occur and may not happen. But if it is, like, then, you have an understanding of why. So I Go ahead. Sorry.
I was just going to say, I didn't know if you were going to move on from surgical procedure, but I wondered if you could quickly touch on, I think everybody knows, like people have seen C-section scars before and they understand, okay, they have to cut through tissue to get my baby out. But can you just really quickly, keeping in mind, most people are listening to this and not watching it. Can you describe maybe some of the layers of tissue? And again, going back to, because you just said, I've just recently had a surgical procedure too. And I felt like, as much as I know some people like, I don't want to know about that, I just found that understanding what exactly is going to happen helped me understand what I was feeling after and why I needed so much rest. And that's what I think the benefit is not to scare you, but for you to understand, like, no wonder I have a hard time lifting my baby, or no wonder it hurts to cough. So wonder if you could kind of explain that for listeners to understand what's under that scar that you see.
So this would be a very major abdominal surgery. So it should be viewed that way, as opposed to just like, a way to get a baby out, right? So usually it's about 45 minutes to perform. You've got this, spinal, or usually they give you a spinal, or if it's an emergent situation, you may have been administered an epidural initially, and then they would beef that up before the surgery. They do a low transverse incision, so along the bikini line, and they're actually making them lower and lower. Like, I've seen some really great incisions in the last year. And so that's great. And then the next layer they're going to go through is a continuous horizontal incision through the fascial layer. They will get to the rectus abdominis, so the depth of the rectus abdominis, and they actually don't cut them. They will pull them apart, usually those lower abdominals, just enough so that they can get to, the uterus, where they would then make a low incision as well. And the incision on the uterus is dependent on the surgeon. So, I mean, some of them make a more of like a perpendicular to the bikini line. Some of them it's horizontal again. So, and then of course the baby is birthed through this incision, and then hopefully, as things have evolved over time, now babies are being rested on the mother if there's no imminent, precautions that need to be taken.
And what will all those layers be sutured, or just the outer layer?
Generally, they will suture up they'll suture up the uterus. And then they will do, sometimes some surgeons will do the rectus, some don't, but my surgeon did. And that's a really excellent question to ask pre-surgically if you are having a planned cesarean. And then, because there's differential evidence whether or not it actually is a better thing or not, because we just don't know yet. And then, they will then do the skin layer, right, with sutures as well. So that's sort of what that procedure is going to look like. And then, of course, as I mentioned, with the way that things are starting to evolve, you can have what is called either a gentle cesarean or a family-centered cesarean, which if you do have to have previous discussion with your provider about this, but some hospitals are allowing more of a gentle cesarean birth, or a slow cesarean birth, where baby is actually being not pulled out, but born through the contractions. So it's much slower and less impact on the mom system. And of course, you could probably agree with the baby to some degree. And then they're doing immediate skin to skin, as I said previously, if there's no imminent, concerns with baby or mom for that matter, right? And sometimes the drape can be lowered if you're keen to watch. So.
Okay. And what about, I think one of the things, that I found really valuable too, so I just had my diastasis repair. That's a surgery I was mentioning. And one of the things I know that you mentioned people can prepare for is just knowing what your pain management is going to be like after, what you should be taking for pain management. This is something I feel like I didn't have dialed in very well. I didn't have, everything in place after, and I really struggled with pain management the first couple of days. And I wonder if you can speak to that. And I know not everybody, you don't always know how you're going to react either, but I know that, in my case, my surgeon gave a recommendation. So I just took what he took or what he suggested. Is that the case normally? Will people be told beforehand, this is what you should have on hand for medications? Like, how does that normally work in the case of a cesarean birth?
Well, yes and no. Like if it's an emergent, then no.
Mm-hmm.
But and also again, it's about education. So it's about saying, look, you need to discuss this with if it's a planned cesarean, you should discuss this with your provider. What are your options for pain management after your C-section? Of course, as you probably have experienced, it's very important to stay on top of your pain.
Yes.
Because and that said, not thinking that, oh, I'm on top of my pain so I can do more, but more so staying on top of your pain so you can have that, reduction in, that sympathetic fight or flight response, because you also need to be there for the baby. And so, with milk coming in and breastfeeding, if that's the route you're choosing to go, keeping that sort of fight or flight system under control can also help to facilitate your milk coming in and whatnot, right? That whole other process.
Mm-hmm.
So I think one of the main things is in the hospital, they will provide you with pain management.
Mm-hmm.
And so I always asked, what is it that you're giving me? What's the dose? And, how often should I have it? And they would be coming to you, right, while you're there. Always with a stool softener too, because the, first poop, as well as, of course, just managing, the ergonomics of having a bowel movement after abdominal surgery can be difficult. So that's a part of the pain management, right? And so, usually it was Tylenol and Advil of some strength administered in the hospital. And then, of course, once home, understanding again how to stay on top of your pain management. So even having them draw up something at the hospital for you to follow, or if you're knowledgeable in that area, then, ensuring that you're just taking enough to stay on top of things when you do get discharged to go home. A lot of your pain management too is wound care and wound management. So, if they are not engaging you in the hospital and teaching you how to manage it, then asking, of course. But a lot of the wound care is going to be, checking the incision regularly. So I would argue like 3 to 5 times a day to ensure that there's, cleanliness to it. There's no issues with it not closing or pussing or anything like that. And
I think that's important. Sorry to interrupt, but
yeah,
I think that I've heard a couple people lately that I think appointments are just not happening as often, especially during this pandemic right now. And it really is important for you to keep on top of your own body and like you said, advocate for yourself, because I think sometimes in my experience too, messaging just gets mixed in the shuffle. Sometimes one nurse might think, that her partner said something. Do you know what I mean? And if you don't feel like you have that plan for medications, what am I supposed to do with this bandage? Do I leave it on? And I would highly suggest writing everything down, because between you and your partner, it's easy to be like, what did they say? I thought you were listening, and because you really do need to be your own advocate. And I think that's the other benefit of understanding what the surgical procedure looks like, so that you're like, okay, this is big. This is why I have so much pain. I'm not weird. I'm not necessarily doing anything wrong. This is expected that I might need this pain for this many weeks, or this pain management for this many weeks. And I think it's all important to understand going into it, just so you're not panicking after, right?
And because of the visits being different in nature, like if you're concerned, take a picture of it, and then, call your provider and say, hey, look, I've taken a picture that, like, a lot of women who have had cesarean sections actually also are with a midwifery team. And so, like, send it to the team, ask right away. Don't wait, right? So, if you're noticing pussing, you're noticing something unusual, or you're worried about, the look of it or the bruising on it or something like that, then definitely, take a picture and send it in, or take a picture so that you have it, so that you can show them when you do have that phone call or that follow-up, right? Because sometimes it is a phone call, or that's easier than packing up and going in. And if they're like, yeah, you know what, that doesn't look great, come on in, then, you can make that trip given the times, right?
Exactly. And I think I like that you touched on the first poop, because I think a lot of people would be like, well, why am I talking about this before? My poops will come after. But like you touched on, I mean, first of all, you're taking pain meds that don't help your bowels move as easily as normal. You're not moving very much, which also doesn't help stimulate. You're producing milk, which is going to dehydrate you a bit. And it all just kind of lends to making it harder to come out. And I can definitely attest to the feeling of a lot of times I think C-section moms believe like, well, my bottom undercarriage is not going to be effective, so I'll just tune out right now. That's the vaginal birth moms that have to worry about that. But you'd be surprised how much the tension in your abdominals, just from everything they've been through, that tension makes it hard to let everything go, right? The tension in your abdominal muscles leads to tension down in the bum hole, and it's hard to let the poo out. And I think, you know, one of the things that it sticks in my head that you said to prepare for your C-section is how you thought about your diet going into it. So speak to that a little bit.
So when I had the experience of having had my first C-section, and then another planned one after that, with my third, I actually made some dietary changes about 5 days before I went in for my third C-section, because I thought, you know what, the diet plays a massive role, obviously, in our health and wellness, both physically and arguably mentally and everything else. But I thought, so what are some of the healthy things that I can do and pursue for these 5 days prior to going in for abdominal surgery? And so I actually, you know, started to cut down on some of the harder foods to digest, and worked on, you know, I had a lot of soups and some bone broths and some, good nutritious stuff, and but kept it easy to digest. And that actually made a massive difference in my postpartum, like initial postpartum poop, because you have to have a poop before they discharge you. And I just noticed a huge level of improvement. And I think it's because I had really taken care and regulated the gut, and also just in my recovery after arguably all my cesarean sections, but my third especially was very, very fast. Now, I don't know if I just don't remember, but I do feel that, you know, it was very quick. And so there is something to do with being, you know, healthy going in to a cesarean, and the outcome with respect to healing and stuff. We all know that the impact of, you know, your physical and, nutrition health has on healing from surgeries and stuff. And so I think that was a big thing that I really was like, wow, that did make a big difference for me specifically. And so I did the same thing with my fourth, and again, it was really great. So I think that's something definitely to consider before think about before you go in for your surgery.
Totally.
If it's doable.
Totally. Can you talk a little bit about, one of the things I go over with clients that come in is teaching them about awareness of their quote unquote core and pelvic floor. And I think a lot of times they think, well, why would I bother doing that before? I'll just fix it after. But I think most women that have been through any type of birth will be able to attest to the idea that, whoa, I didn't know what those muscles felt like, or trying to figure them out after the fact seemed a little overwhelming. And so, I'm a huge fan of helping them feel connected to those muscles, just so that okay, that's what it feels like to tighten those muscles. That's what it feels like to relax those muscles, and work on that, so that the brain has a connection to them, and they learn what that feels like after. Like, how can I help connect those muscles so that if I lift my baby, I feel a bit more supported? So I wonder if you can speak a little bit to, when do you maybe necessarily suggest that women during their pregnancy, when do you bring it up, or when do you incorporate it into your education or into their exercise?
I kind of do it from the very beginning, really. Like, I start with, like, I kind of formulate it into any of the functional exercises they're already doing. However, I do ask them to create a time or space where they can be a little bit more attentive to their breathing and pelvic floor and core. So, why don't you grab a little squishy ball, sit on it, see if you feel like you're relaxing and connecting, see if you feel that, pressure into the ball, see if you feel like you can, offload and improve your connection, figure out the difference between lying down and doing it on your hands and knees versus standing versus sitting, so that you have that awareness in all different positions. Try it in a squat. What does it feel like, right? And then, of course, teaching them the relationship of the body to the pelvic floor and core, and of course, breathing and the relationship there as well. And then speaking to, different things they can do to offload the pelvic floor if they're feeling, like they need to. And then, like I said in the beginning, integrating it into their functional exercise program. So if some of these moms are already, working out or doing prenatal yoga or whatever, just explaining to them and educating them on how it can be integrated into those programs, because you don't stop strengthening just because you're pregnant, right? And you don't need to stop strengthening, 2 weeks before you deliver. You can keep going if you want to. I think that myth needs to be dispelled for sure, right? But spending some time on, down training, offloading, and, learning to relax the pelvic floor and stuff is important. And so I will add that in as a side project, I guess, in a way. Because a lot of the issue postpartum with C-sections, a lot of women experience pain with intercourse and experience issues like that most people would be like, oh, well, that's, more so related to a vaginal birth. Well, no, it's not. So you can have the pain with intercourse because of the tensioning in the pelvic floor, or because of, post-surgically, or just like you said, there's a lot of sort of guarding and bracing and mechanisms that we use to try to get ourselves around and support the baby that may be putting pressure on the pelvic floor, and who knows, right? The mechanics of it all, right? There's many ways to explain it, so we won't get into that. But
yeah, exactly. It's just kind of just understanding, like, this is why your body feels different during pregnancy. These are some muscles you can be in tune with to help your body feel a bit stronger. But you're right, focusing too on the ability to relax and then carry that same awareness postpartum. And I think, like you just touched on, the importance of learning to kind of relax. And I think that ties in really nicely with the one last thing I want to talk about with ways to prepare is mental prep, because I think that, we talked about the anxiety or the sadness or the letdown that a lot of women feel. And I think if you really think about what those feelings make your whole body feel like, it feels overwhelming. You feel sad, you probably feel tense. And I think there's a lot to be said about, what do you need to do to prepare mentally? I mean, is it beneficial for you to see a counselor to talk about some of the things that you have going on in your head about this birth decision or this birth choice? Or in my case, leading up to this surgery, I did a lot of meditation and just mindfulness, because I knew that I was going to be in pain and stressed after. And I just felt like I needed to find that headspace and that body connection. And I think that's something that gets downplayed a little bit, that, it's normal to feel stressed about it and feel overwhelmed, but noticing your body's reaction and learning how to kind of, relax into the decision, or,
Yeah. And I think there's there's different personalities, right? There's doers, so I think, like, in my position as a public health physio and often the only person that a lot of people are seeing right now outside of their family, I speak to, well, what makes you tick? Like, what would make you feel comfortable to be able to feel, supported and relaxed and whatnot going into this? And, for some women, it's like, well, yeah, I just feel like meditation is going to do it, or yoga, or, like, I need to go work out and I need to, like, and, for some people it's going to be, well, I think, cleaning my house every day will make me feel great, or, or getting all the baby stuff ready, or, for me, it was very much ensuring that I had my supports in place and knowing that, I could I worked out to the very end, and then did a lot of prenatal yoga as well, and then made sure that I had things that I was sure that I would need in those initial days. Like, I did use a support garment after, and that was very helpful for me. And just having, I guess, your bag packed in a way so that you felt, and your bag packed, meaning that could be meaning like emotionally or physically, or, the stuff that you feel that is helpful for you. And so I think also one big thing is discussing with your partner and or family that is going to be there supporting you as to what you feel your needs are, and that those can change depending on the outcome as well. So that, people do know and understand, the importance of supporting you and what the procedure is, so that they understand, well, I can't ask her to get up, get her own whatever, right? Or expect her to want visitors all the time. Not that we can have them, sadly, but you know what I mean, right?
Totally. I think that's a great, like, even if it's like a daily check-in, where are you at? What do you feel like you need help with today? Because we were talking about this before we hit record. Like a lot of women and moms are not good at asking for help. It's not our nature for a lot of us. We're the doers. We're the ones that organize everything in the family. And it is genuinely a time to really take care of yourself too, even though you've got this baby that you also have to care for. So like you said, calling on your supports as best you can. You mentioned really quickly, one of the last things I want to cover is compression or abdominal binders, because I think this is something, again, as someone that's recently been through something, it's not easy after the fact to be out shopping or to be necessarily ordering anything online. And I was definitely happy to have a plan in place for after. And so I wonder if you can speak to your experience with using kind of a abdominal binder or compressive garment, and, something people should look into.
Yeah, I just had two of my moms that I have been seeing prenatally who had, by choice, cesarean sections a couple of weeks ago, actually, or a week and a half ago, reach out because they were like, well, they have other kids, and they're like, my back is just like, I need something, right? And we did discuss it prior, and so both of them actually did end up getting the Belly Bandit Cesarean C-section recovery undies. So that's something that you can pull on and almost does up like a bra. So it's like a corset, but because you're pulling it on, it's reducing the pressure from coming from above. So it's not like that, just bind it like that, right? It's actually a supportive garment, right? Now that's what I used, and I felt that it was, wonderful. A couple of my moms have also used the Knixwear postpartum underwear garment, and they've, like almost like the one that has the crosses, it's like a core compression support. And they found that very helpful as well, because it's leak proof too. That's less compressive than these other ones, but I know after having my fourth, for sure, it felt better for me to put that on. Now, I wasn't relying on it all the time, but it definitely helped. And then, of course, my whole return to run process was something that I wanted to focus on. And I did initially wear it when I was starting my return to run program, because after 4 cesarean sections, I did obviously a lot of work to ensure that I recovered, but I just felt like, for whatever reason, that extra little bit of compression was helpful to strengthen me in the process of returning to run and stuff. So
totally. And I would say that it speaks to, definitely compression we know is helpful for swelling, but also too, I would say that a lot of people describe, and I have felt this too, that just that support allows you to relax, allows you to breathe, and allows you to feel a bit more confident in your movement. And at the end of the day, not that I'm saying that right early on, you need to get moving more, but you need to be comfortable in your movement. You have to move a bit. Can you Tamarah, I think that everybody would say something different. And I don't think a lot of women are sent home after C-section being suggested compression by their care provider. I think most often, like with the surgery I had, I think most people are sent home with compression. So guidance as to when they should start it. I still wasn't given super clear guidance, but I understood that my wound or my incision needed to be happy and healthy and able to be covered all the time. But what would you, I guess what I've been telling people is, I don't want to say just use it because I just don't feel comfortable. I'm not the one that's the wound expert. I'm not the surgeon. So generally I say, and tell me what you say. I usually say, ask your care provider if there's any reason you can't, because generally it's for comfort. And as long as the wound is happy, would that be what you say, or what do you tend to tell people?
Yeah, wound happiness and also like body happiness. Like for some women, obviously the uterus can very quickly resolve, recover, whatever. For me personally, I found with every single one, it was around 2 weeks that I felt comfortable wearing them, just because of the compression that they gave.
So you didn't feel comfortable wearing them before? The compression?
Not before that.
No?
I tried them at a week. And I still felt a little bit like, that's a bit too much, just too tight. More so because of this incision, right? And then around a week and a half to 2 weeks, I felt like, yeah, I can tolerate this. It doesn't feel like it's impeding on the scar. And it actually felt comfortable over, being over the scar. So I think it is a little bit sort of depends.
Yeah.
But at the same time, I would say, give yourself a week to two to just heal and, rest. And then, at about a week and a half, you can start kind of considering or thinking about some of the things that you can add into your toolbox, or if you've bought it, you can try it on and see how it feels, right?
Mm-hmm.
But test the waters a bit. And if it doesn't feel right, then obviously don't force it, right?
Mm-hmm.
Mm-hmm. I did actually have a patient last year that was given before she left the hospital, was given a abdominal support garment, actually post C-section. And it was her third. It was her second cesarean, third baby. And she was given the support garment by her OB/GYN that did the surgery. So I was actually pleased to hear, before she left hospital, so I was pleased to hear that was actually a thing that happened, because some people do need it.
Totally. I actually saw a study the other day, and I can't even remember it was 2019. I can't remember any of the names, but they did, I don't even remember how many people, there was at least 100. It was a randomized controlled trial where they looked at, after abdominal surgery, most of the clients were C-section moms, and they said they did abdominal binder versus none. And they found comfort wise, they were more comfortable having it on, but also they didn't notice a big difference after, I think, 4 days, but after 7 or 10 days, they were noticing their mobility was better. So I'll link that just in the show notes so people can see. And I think, again, it comes down to comfort, at the end of the day. And I think
if it reduces your pain and makes you feel better after being upright and moving around, then why not?
Yeah.
Like who are we to make the rules around when it?
Exactly. I think one other thing that we didn't touch on, I've noticed a big difference in the last few months, maybe a year or so, that because I'm starting to see more and more women come in during pregnancy and saying, I want to hear about ways I can be proactive. And people ask, when should I see you after? And I tend to say, I'm curious to know what you say. I tend to say, as soon as you're ready, because it's not going to be about intense exercise. It's going to be meeting you where you're at. And I do a lot of those first appointments via online appointment so that you can do them at home without having to come into the clinic. And generally I hear a lot of either, oh, I wasn't expecting to have a C-section. Can you walk me through this? Just wasn't what I looked like. So can you give me an idea of some things that I can be doing, like we just talked about? Or,
Mm-hmm.
oh, Melissa, like I'm having a hard time moving, can you give me some suggestions? So it's not, I think sometimes people think like, oh, that's too soon. Like, are you sure I should see you at 1 week after? No, you don't have to. But I think a
No.
lot of people, you can just see it eases their stress when they're like, okay, I'm normal for feeling this way. It's normal for me to
Yeah.
have some discomfort. It's
Mm-hmm.
normal for me to feel swollen. Here's a couple little tricks and tips and tricks I can use to get out of bed or out of
Mm-hmm.
my chair. And so I'm a huge fan of women reaching out as soon as they're ready. And I think that's going back to ways to prepare for a C-section,
Yeah.
is have a bit of a plan after, because you're going to keep putting yourself to the bottom of the list. Like, oh, got to do this for the baby.
Yeah.
I've got this appointment for the baby. Make yourself an appointment. And I often say, make it whenever, what do you think? What do you think you want? Oh, I think I'd want it at 2 weeks. Okay. Make it at 2 weeks. And if you get close to that appointment and you feel like that's too soon for you, move it. Like,
Yeah,
but then at least you've got
exactly.
it in your calendar. You've got something to take care of yourself, and
Mm-hmm.
and so I think it's
That's
important.
basically what I say. I kind of go, why don't you, book something now?
Yeah.
I always kind of encourage that, because in the whirlwind after delivery, you just forget,
No.
right?
Yeah.
So I always encourage, book something now. Let's do it based on your due date. And then, if it falls after or before, then, you can change it as you need. But I usually try to say, I really try to encourage, obviously rest for the first 2 weeks,
Mm-hmm.
and you can have active rest too. Like, you
Totally.
don't have to just be sitting.
Yeah.
But so I try to say, if you have any questions or concerns, why don't you just, shoot me an email or a text message or something, if you feel like you need something before 2 weeks, and then but then let's book an appointment after the 2 week mark. And whether it's, virtual or they want to come in, doesn't matter to me. That's up to them for sure. And otherwise, if they're like, nope, you know what, I'm just going to book something down the road, I say, okay, definitely between the 4 to 6 week mark. That's like,
Mm-hmm.
right? Because they could go before or they could go after. And so anywhere in there is going to be, doable, right? So, and then they can always change it. Like,
Absolutely.
I'm not a stickler with changing things. So
Absolutely. And I think that's, again, the benefit of coming in, like as a being proactive, coming in during your pregnancy. Generally, we can say, until I talk to you, all I want you to do is rest and breathe. Or, you can kind of say, or for
yeah,
you, I want you to think about this, or, and it gives you just like, okay, I'm working on something. I'm doing what I need. I'm doing all the right things. I don't need to be doing any more than resting.
yeah.
And I think that, I hope that this, all of these kind of ideas help people understand that there is so much that you can do, not only, for your physically, but also mentally. And I think unless there's anything else specific you want to touch on, Tamarah, I think we've covered all the
No.
basics. And
Yeah.
again, I just want to thank you so much for everything that you do to advocate for cesarean, like women that are choosing to have cesarean birth. And I've always had such respect for people that have cesarean section, but I think that until you go through it, it's really hard to, I don't know, to totally understand. And I think now after my own surgery, I get it a little bit more.
Exactly. Yeah.
And it's not something easy to go through. So thank you so much for
No.
everything that you do.
Yeah.
And again,
Thank
I'm
you
going
for
to link.
having me.
Yeah. I'll link in the show notes, a webinar that Tamarah and I created, so that if you want more information, or if you want to be able to watch this with your partner, you'll be able to purchase that webinar in the show notes. And again, thanks so much, Tamarah.
Thanks.